The modern FUE method is not even 30 years old, and what came before it looked so bad that you wouldn't believe it. Let's go back to the 1950s. That's when hair transplantation began at all. But how? Entire patches of hairy skin were transplanted. Hair transplants were mainly performed on war veterans after facial reconstruction. The primary focus was on saving lives, while aesthetics were of lesser importance. In the 1980s and 1990s, the FUE method emerged, a strip of skin from the back of the head cut into follicular units, a big step forward. But the scar remained. A linear one stretching from ear to ear. The effects were still far from perfect, so groups of hair began to be taken with a tool a few millimeters in diameter. It often looked like hair on a doll, until a certain doctor said there must be a better way. Dr. Inaba. The year 1988. He published a paper on the technique of extracting single follicles, but no one was interested. The tools were too imprecise. The idea waited in the drawer for its moment for several years, until the year 2002 came. Two doctors, William Rassmann and Robert Bernstein, published an article in Dermatologic Surgery. They described the FUE technique as a new, minimally invasive method of hair transplantation. And that was the moment when the world woke up. No linear scar, shorter recovery, less pain. Patients could return to normal life within a few days. The method began to spread around the world. In the following years, the method only improved. Tools with a diameter of less than 1 millimeter appeared, along with better precision. Better tools for storing the grafts and improved implantation techniques. Today, FUE is the global standard. Minimal invasiveness, minimal scarring, and a natural effect. And a personal digression at the end. Dr. William Rassmann, the same one who wrote this article in 2002, is still practicing in Los Angeles. In 2018, I had the immense pleasure of spending a few days with him as an intern. He is a man who changed hair surgery worldwide, and he is still operating. When you leave the procedure today, know that it is thanks to decades of trials. Once, a natural effect was practically impossible. Thank you for your attention and see you in the next lesson.